All right, thank you, President Cohen. All right, so kind of like we've been doing for a while now, every 2 weeks, we'll have our traditional COVID update. We've added a few additional slides just to provide, some additional information for the community. So we'll go ahead and get going with that, David. If you could skip to, all right, so the COVID update, one more slide. So this isn't going to come as a surprise to anyone, but when we look at the Oakland County trends, we can see as far as total confirmed, cases by day, they track the 14-day average for case count, death count, tests per day. They've all increased. And also we look at the age groups, whether it's 0 to 4, 5 to 9, 10 to 13, 14 to 18, 19 to 29, so on and so forth, that the data in Oakland County not only matches what we're seeing in the Tri-County area, but what we're seeing out of state and nationally as well. Next slide. So one thing I do want to touch on is we know we're continuing using two different key metrics, even though, it's multifactorial. One is the case rate, and we've talked about that before, but I also want to talk about the positivity rate as far as what that looks like and what we're looking at. So it wasn't really clear when we reflect on the 820 meeting as far as how we were looking at that. So we made it clear that we were looking at a 7-day moving average with a 3-day lag for the case rate. That's also what we're going to be looking at for the test positive rate. A couple reasons for that. One, it's absolutely consistent with the way that we track the case rate. Also accounts for a decision the state of Michigan made a while back, which was in September, where the state of Michigan decided that it would no longer report COVID-19 data on Sunday. Therefore, those numbers would roll into your Monday and your Tuesday total data drops. And so we want to make sure that we're accounting for that. Also, it's a more accurate representation since there's a lack of consistency in the data. For example, if you go on the website for mi.gov, you'll see on 10/29 when they went to pull the data, there was a technical difficulty. Therefore, they couldn't pull it until the next day. So those numbers that could have been reported on 10/29 could not be reported until a later date. So if you look at the two different lines, the blue line is going to be the test positive rate for that day, and you can see how it fluctuates. And then if you look at the 7-day moving average, it gives you a more accurate description of what's going on over that time frame. Next slide, David. Also, when you look at October 16th, and a lot of times I talk about the October 8th board meeting and where we were and just how different it continues to change. You can see October 16th in the United States, where we were case-wise, we're a little over 50,000 as far as daily confirmed COVID-19 cases, looking at a rolling 7-day average. Now we're well over 80,000 and approaching 90,000 cases daily. How does that compare nationally? You can see India's dropped, but you can see France has gone up. You can see the United Kingdom has gone up. And you can see Germany's gone up as well. But all that pales in comparison to where we're at as a country. Again, this is nothing new. I know everyone's watching the news on the election and other things, and COVID is continually one of the stories. We all know that numbers are increasing. Next slide. So as you can see, the dashboard, and we took this from a couple days ago, the numbers for the case rate continue to go up. As far as percent positive, that continues to rise up again. Again, nothing new, but information we've talked about before. And I know there's been some additional questions about data and data sources, so we're going to talk about that a little bit. Next slide, David. So there are many different sources to choose from for our compiled data, which is related to COVID-19. These are just a few of the examples that are out there. There's Johns Hopkins University, there's the Center for Disease Control and Prevention, there's New York Times, which feeds into COVID Act Now, there's the state of Michigan, and there are many other data sources as well. Next slide. So we've been working with Munetrix, and we've been doing this for a while. So Munetrix uses data from the state of Michigan coronavirus website. There's a couple of reasons that they've shared with us. One, not every dashboard that is available online provides full data files to be used by the public. The state of Michigan offers consistent and updated data that is easy for normalization, batch uploading, making Munetrix charts updates quick and easy. Also, the state of Michigan would be a more direct source to those reporting the data initially than others, such as the CDC or another source. Michigan data was the focus. Obviously, we're in Michigan, so that was the data we're focused on as far as school decision. So sources providing additional data for the entire US or worldwide did not necessarily have added use. So next slide. So sources for the Munetrix dashboard. So there are several different data sets that are on the mi.gov website. So Munetrix is pulling from daily cases. So you can see the public tab to the right. You can pull cases in death by county, cases in death by, date of onset, case by demographics. Also the top bar, there's the current status, daily cases, the trends, demographics, total testing, diagnostic testing. In a tab for learn more, Munetrix pulls from the daily cases. Just kind of as a side note as well, that the Munetrix, as far as pulling from the daily cases, that is where the state of Michigan pulls from on their dashboard. So if you go on the dashboard for michigan.gov, that is where the public, if they're looking at the dashboard on the state website, pulls from the daily cases as well. Next slide. Some additional notes that Munetrix shared with us about the data. The state's daily posted tally for confirmed cases means that there was a positive laboratory result and data was collected for each case. So after the state of Michigan receives this data from the provider, it almost immediately delivers the same data to each county for investigation. The county level investigations may uncover illness onset dates for the cases that will change the data cases counted. So sometimes cases will change to an earlier or later date. Munetrix also uses the most updated data reflecting the investigations done by the county health department, which can lag the initial counting total by a few days or more. This means a case may have been on the state of Michigan's front page dashboard on one date, but a county may have discovered the onset date and adjusted it. The reason for this is due to the hierarchy the state of Michigan uses to count cases: onset date, collect date, referral date. But in Munetrix, the entire database gets refreshed daily, so it is the closest to actual county-wide data available. Also, a disclaimer that Munetrix provides no warranty or guarantee for use of this data, which is covered as part of the provisions of Munetrix terms of use, which can be found at munetrix.com. But again, that same database that mi.gov has as far as what they're showing to the public, that was in the slide before, so anyone can go there, click on daily cases, and find that as well. Next slide. So we know all along, we've talked about we're preparing for a couple things. We're planning for a couple things. We've been planning forward. What happens if we go to a full return? We've been planning for where we're currently at. What happens if we remain in our current configuration? And we've been planning backward. What happens if we have to pause temporarily and go to distance learning again? So if we enter into red, then all students will transition to fully distance teaching and learning upon Board of Education directive. So transition to distance learning, all students with the exception of Bloomfield. So what happens? If we hit red, based on the metrics, an emergency Board of Education is called. Likely this will be for the next day. Students continue to attend in person as scheduled on this day. The decision: if the Board of Education makes the decision to pause in-person teaching and learning, what happens? It depends on the building. K-8, SEED, and DHH preschool, day 1, no school for students. Families collect belongings as needed. Day 2, asynchronous learning at home. Day 3, distance learning begins. Looking at BHSTV, Bowers, Prep. Day 1, distance learning or no school, or continue if already in. As we know, we had to pause in person at BHHS based on the number of staff in quarantine. And so if we were to hit red while BHHS was still paused, then they would continue with the distance learning. Day 2, asynchronous learning. Day 3, distance learning. IA, IA begins distance learning in day 1, continues in day 3, day 2, continues in day 3. Wing Lake, day 1, no school, students collect belongings as needed. Day 2, asynchronous learning at home, the Wednesday schedule. Day 3, distance learning begins. Blooming, day 1, 2, and 3 close. Just a note at the bottom, Bloomfield virtual classes continue as scheduled. Blooming will be closed and Blooming will be closed and credits will be issued for days closed. DHH, ARP, FRP will follow their assigned building of attendance. Next slide. If we do need to pause, the question I'm going to have, and many people have right away, what does the return to in-person look like? We will continue with the same priorities we had before when it's time to re-enter. Early on, SEED, ARP, FRP, DHH, Bowers, Prep, Wing Lake, and Blooming will be priority 1. Priority 2 will be grades K through 5. Priority 3 will be grades 6 through 8. Priority 4 will be grades 9 through 12. Continuing on. So if you've been on the district website, you've noticed that the Bloomfield Hills Schools real-time COVID-19 data, the bar has been increased and it's been moved up higher, so it's easy to see right away. There's also been some additions and updates to that as far as how the data is displayed. So you'll see that as we go along. But I also want to make sure the community knows, because I want to make sure the community knows exactly what we're sharing. I know everyone knows the letter comes out. You're able to see the letter if you've decided you want to see the letter. But I think it's also important to look at all the details that are on the dashboard, because some people might want to see it visually as well. So we'll just go through that so everyone's on the same page. Next slide. So the first one is student confirmed and probable cases based on the date that is reported to BHS. And this is as of 11/4 at 12:09 p.m. So this was pulled today. It does not reflect the email that came out at 5 this afternoon. Next slide, David. So here's one of the updates that was made by communications today, just so you can kind of see based on the date, how many cases were there and where were the cases. Again, making it more user-friendly so that those people who prefer to go online and see the data
Did Pat freeze?
He did. Looks like
he
he
did, right?
was there.
Someone want to jump in from Pat's team? Susan or Pat's back?
Pat, we can't quite hear you yet.
Pat, you're on mute. So again, someone from Pat's team want to jump in?
Paula, can you hear me?
Yeah, we can hear you now. Yep.
All right, great. Next slide, please. Thanks, David.
All right.
All right, so this one is student confirmed and probable cases. And we've also broken down by test. Remember, if someone takes the rapid test, the antigen test, it comes across as probable. If it's the PCR test, it comes across as confirmed. So we broke it down as well so the community can see that. Next slide. So student confirmed and probable cases by school. Again, trying to provide as much transparency and detail for the community. So now you can see it broken down by school. So this will be the probable cases by school. The next slide is going to show probable cases by grade. So not only can you see by school, but you can see by grade as well. And then the next slide is going to be staff confirmed and probable cases by date. The next slide, David, is going to be staff confirmed and probable cases by location. Again, this is updated automatically once we get a new case on the district website. So it's not a matter of making sure someone has to go in. So great job by the communications department to make sure that is seamless. Again, for our community members who want to look at the letter and read the letter, great, they have all that information. Then if they want to go on and see, well, how many cases has there been in the building? And was this a positive PCR test? Was it a antigen test? So it's a probable case. And how many by date again, by building? They're able to see that information. Next slide. Again, we can't stress enough how important testing is, in that if you don't feel well, please stay home. If your children aren't doing well, please keep them at home so that we can keep the schools open as long as possible. It's important that we continue to work on this. If you need or not sure what to do, this hotline is available, Safe for School hotline. There's no cost. You can call in between 5 a.m. and 8 a.m. and you can talk to a nurse on duty and just share, here's what's going on with my child today. What do you think? And get some medical advice. Again, I think the best guidance I can give, and I've talked to a couple of people about this today, they're like, well, this happened with my child, Pat. I'm not really sure. If you're not sure, please keep your child home. If you have any doubt in your mind, like, well, I think they're going to be okay, it probably was food poisoning, please keep them home. Next slide. So, thank you, David.
Thank you.
That is the latest update on COVID-19.